I was assigned 5 minutes to talk about the centrality to providers and professional societies' mission. Guidelines are what we do. We as clinicians take care of patients first and foremost. We have other roles, but that's what we do, and providing excellent care is what we do. So I was like, okay, I can talk about guidelines and professional societies. So let's see. Next slide. I am pushing the button. Okay, this is good. So I said I can do those two things. My history is I chaired a guidelines committee. I chaired the East Guidelines Committee for 3 years. We put out a lot of guidelines at the time. And then a few years later, I was the president of East, and I talked about East Guidelines in my presidential address. And I talked about that it is the perpetual quest for excellence, excellent clinical care, and guidelines is a pathway to be able to do that. So I felt like, okay, I thank you for the 5 minutes. That's exactly what I can talk about. And what are the benefits of guidelines? And you'll hear it again and again. Why should we be using guidelines for patient care? They reduce inappropriate practice variation. You guys do one thing one way, you do it some way different. We should do it the same way if there's evidence that shows that that's the best way. So reduce practice variation, speed research to the bedside. People have heard it takes 7 years for research from randomized trials to get to patients. That's too long, and this is a way to rapidly get the right care to the right patient at the right time. Improve quality, safety, and the clinical care we give patients. Lots of data that guidelines reduce disparities. So if you're giving the same care to everybody, if there's a disparity and you implement a guideline, you can give the same care to everybody. And then cost. We waste a lot of money. There you go. Next slide. Should I aim there? Does it matter? I'll aim this way. Close enough. So now I can't see that one. So guidelines. If I had a mic, I'd be, oh, this is perfect. So guidelines, I already said some of these things, so that it's bringing scientific evidence and experiential knowledge and patient input. The patient input is going to be important. I'm going to talk about that a little bit. And it's the same things I just said, right? Reduce practice variation, improve safety, improve quality, research into practice. You're going to hear it again and again. This is why we do guidelines. The cost of trauma is gigantic, almost $700 billion a year. So the cost is huge, and we can decrease that cost as well. So I was also assigned the who are we in the audience. I'm sorry if I'm not looking at this end and you're only seeing my back. I'm trying my best here. So our audience today is broad representation. Last time I was in this meeting, it was almost in this room for a different meeting. It was almost exclusively physicians. Okay. Today, we've got about half physicians. As you might expect, there's a bunch of doctors in the room, but there's a lot of other people as well. Nurses, advanced practice, others, and people that are not clinical, and that's okay. Broad range, lots of different degrees as well. It asks the question, and this is the survey that many of you took, so it's not perfect, but it gives you an idea of who's in the room. We are guideline developers. I talked to other people who chair this guideline committee or run this algorithm committee. Those are the people in the room. You were specifically selected to be here. This isn't just a conference you sign up and as Lacey said, you just sit and listen. We want your opinion. What's your job description? And I realize you can't read all the little words, but it's the same survey material that you've filled out before and we're sharing now. Is part of your job dissemination and quality improvement? The answer is yes, for over half of the people, right? So that's what we do on a day-to-day basis at our clinical job or at a society or whatever else we do. The other piece is research. Many of us are researchers. Why do we need research? Because research is going to fuel the guidelines. Without the good research, we don't know what the guidelines should be saying. So we need people who are doing that as well. It's important to talk about it. I work at an urban level 1 trauma center in East Baltimore, but we can't just have that perspective, right? So this idea of, are you a rural provider. So it's not that it's zero, it's not that it's 100% a rural, but there's some rural representation. Same thing about pediatrics. I don't treat pediatrics, but it's an important component of what we do in trauma. So having the pediatric perspective. So just giving you an idea of where people are coming. This is probably one of the most important demographic slides. This is patients. Who is a patient advocate? And there are people here that are representing the patient perspective, because without that perspective, I think we can do a lot of stuff in clinical and a lot of stuff in research, but you need that patient perspective. And I'm happy that they're invited in the room today. And then Eileen already talked about diversity, equity, and inclusion. Many people in the room, including myself, have a professional role somehow in DEI efforts. This is a list of the professional societies that we represent. Many people represent more than one, right? So I happen to be a member of EAST. I happen to be on Center. I happen to be AAST, et cetera, et cetera. Many people in the room represent one and only one, but many of us cross societies. So just think about that. And finally, Center again. So this is the Center button. If you want to find out more about Center, there's a lot of Center people here. Center is an amazing group that a bunch of trauma organizations got together and really helped fund and get started, and now is getting millions and millions of dollars of research money. Driving research is critically important, and we should all be working together to collaborate, cooperate, get wide coverage of research and ongoing continuity. So with that, that's my last slide. I'm going to pass the mic to someone else.